Hi, my name's Padraic. I'm a urological oncologist. I did my medical school at Xavier University School of Medicine, followed by my urology residency at the University of Toronto, and a Society of Urological Oncology fellowship at Weill Cornell Medical College in New York, prior to joining the team here at University of Florida Health. So my clinical interests focus on urological oncology, primarily bladder and kidney cancer, but also prostate and testicular cancer as well. Clinically, we use a multidisciplinary approach, and we also employ both open and robotic techniques for our patient surgery. So my approach to patient care is very individualistic. Patients are individuals and they're human beings that all have their own sort of past and stories and experiences. And if you ignore those, you're ignoring the strengths and weaknesses that your patients may have. And those are important when you go to guide them through their journey. I think we look at that and look at patients on the individual level, but at the same time we have a strong adherence to sort of national cancer guidelines, as well as using clinical trials to help these individual patients optimize their cancer care and to help them not just with their cancer care, but also with their quality of life, which is also extremely important for these people. Current research interests really fall into three categories. We have an active clinical trials program here for genitourinary malignancies at the University of Florida Health. Our second area of interest is partnering with colleagues in the basic sciences, basically in a lab setup, and developing transitional research to sort of bring the benchtop to clinical patient care. And finally, our last area of research is sort of our own investigator-initiated trials, where we're currently trying to develop a program for renal mass biopsies in patients with small renal masses, and that's an ongoing project currently. So I joined UF Health Urology about almost 3 years ago, and the real reason I came and joined was because of two main factors. One was the leadership within the department, both with Dr. Li Ming Su and Dr. Paul Crispin, and second is the collaborative atmosphere that exists here. We're very fortunate in the sense that we have good team players both in our own department as well as in other departments, including medical oncology, radiation oncology, as well as other surgical subspecialties that we often operate with. The collaborative and team atmosphere that exists at UF Health Urology, I think, goes a long way to improve patient care and improve patient outcomes and help them in their cancer journey at this institution.